every one of us have some or other doubt regarding fever. Let us see the top 10 doubts on fever today. Hi friends, I am Dr. Karamat and this is Scientific Doctor. In this channel, you will view videos on simple health related topics which will be released every Wednesday. If you want to see such videos, kindly subscribe to this channel. Also press the bell icon for instant notification on new content. In my clinical practice, what I have noticed is every one of us have doubts, especially on fever, which is the most common presenting symptom to a common clinic. So I have compiled the top 10 doubts on fever which we will discuss today. The first one is fever is always bad. We now know from the last video which lists the causes of fever, the link of which is given above. Fever is caused by infections, but fever itself, is it always bad? No. In fact, fever helps in fighting these infections. And the next common doubt is, does the fever indicate a deficiency of the immune system? My child is getting frequent fevers. Does it indicate deficiency of the immune system? Again, the answer is no, because fever itself is a manifestation of our immune system fighting against that infection. Infection alone doesn't present fever, but our immune system and the fight it does also contributes to the fever. So fever alone doesn't indicate deficiency of the immune system. The second most common doubt which I have come across is the parents say, suddenly the fever has come up. The child was normal till 8 p.m. By 8:15 the child developed fever. So why was there no warning before fever? We must understand fever itself is a symptom. A symptom is a sign of a disease like a dengue or a typhoid or a malaria or a viral fever. Fever itself is a symptom or a sign. What does it signify? That itself is an alarm bell. So what can precede an alarm? Sudden appearance of fever is not something to be worried about. That's how it operates. The third doubt is, higher the degree of temperature, severe is the disease. It appears very logical, but it is not always so. For example, in simple illnesses like viral fever, which may disappear even without any treatment, the fever might be high even on day 1. But on the contrary, some serious diseases like tuberculosis may have low grade fever to start with. So the degree of temperature does not always correlate with the severity of illness. The fourth doubt is, if the fever becomes high, the child may develop fits or seizures. To an extent, the degree of temperature might affect the predisposition for seizures, but more than that, there is a genetic predisposition to having this condition called febrile seizure. That is, if your parents are affected, you are more at risk. Again, this is an age dependent illness. That is, between 6 months and 6 years of age, there is a risk for febrile seizure, not for older children. Degree of temperature alone doesn't determine it. As I said, genetic predisposition, the kind of infection which caused the fever, the age of the child, all this predisposes to seizure. So we need not be worried about the temperature alone for the appearance of seizures. The next common doubt is fever in the head or perception of increased temperature in the head region is a cause for meningitis or brain fever. No, perception of fever or perception of temperature in individual region will depend upon so many factors, including the blood flow to the region. For example, after a vigorous exercise, if you feel the muscular regions, the muscles which were exercised, they will show an increased temperature. Your tummy might be slightly warm after you eat. So, perception of temperature in a particular region doesn't signify illness in that region. And also, children might feel warm in the head region for reasons unknown, probably because of increased blood flow to the brain, because the brain is rapidly growing, and other reasons. They might be crying, other reasons your head might feel warm. That doesn't signify it is a brain fever or a meningitis. The sixth common doubt, is it essential to bring the temperature to normal always? Low grades of temperature, if it doesn't affect the activities of the individual, you need not bring the temperature. even in high grade fever, after giving antipyretics, that is the medicines to reduce the temperature need not come down to normal. The role of these medicines is to make the person comfortable, to make them feel better, not to make the temperature to normal. Seventh doubt is, why do we have chills or feeling cold in fever, and can we use air conditioners during fever? As we have said in the last video, fever is due to a dysregulation in the hypothalamic set point of the normal temperature. That is, there is a disruption in the normal temperature, the body tries to increase the temperature, that's why you feel chills or you shiver. This happens especially during the rise of temperature. Usage of air conditioners is not contraindicated during fever, but what we must avoid is low temperatures might increase this discomfort or may cause shivering. So not having very low temperatures but to have medium temperatures is absolutely fine. The finest example for this is almost all the hospitals today have air conditioners. So it is okay to use air conditioners but not to set very low temperatures. Can you take a bath while you are having fever? This doubt arises especially in our part of the country, Tamil Nadu, but even other places they might have taboos regarding taking bath during fever. What do we do when the temperature is more? We give sponging, that is practically equal to bath. So to cleanse ourselves, having a bath during fever is never wrong. But what we must understand is the head bath, especially in our part, is like a ritual which is done for a longer duration, which is done like an exercise. You avoid exercise during fevers, so you may probably avoid head bath during fevers. But to cleanse yourself, having a bath is never wrong even during fever. The ninth doubt that people have is, what food should you have in fever? We must understand during fever we have a loss of appetite or anorexia. We don't like to eat food and we tend to lose fluids, so we may be dehydrated. So what you should advise is simple homemade stuff, and especially more of liquid food and more of water to avoid dehydration. And the other doubt people often have is, can I take fruits or curds during fever? It is absolutely okay to take fruits and curd during fever. The 10th doubt or the mistake people do, especially in modern times, is what test should be done, or they take test on day 1 itself for fever and come with the results. There is no such test as fever panel or fever test. The test for fever should be determined by the doctor based on the fever pattern, associated symptoms and the clinical examination which the doctor does. So you can't predetermine what test to be done for fever and take test especially on day 1, because mostly the diagnosis on day 1 will be clinical. There need not be any test done on day 1. But a little note of caution, especially when you are having any epidemics and when you are having danger signs, doctor might advise some tests on day 1 itself. But anyway, test or blood test should be done only based on doctor's prescription. Friends, today we have seen top 10 doubts which my patients bring to my notice. You might have different doubts. If you have any doubts, kindly put them in the comment section. We will answer them there itself. Otherwise, if there are too many doubts, we will make a separate video on those doubts also. If you would like to see such videos, kindly subscribe to this channel. Till the next Wednesday, bye.